Please go ahead.
Hello, everyone. I'm so excited being here back after 2 years, so it's a great moment for me. Yeah, it will be difficult because I will need to compress 5 years into just 10 minutes, so hold tight and let's start. Okay, first of all, this presentation, it presents the perspective of a biostatistician. A lot was told about the perspective of statistical programmers, but biostatisticians have sometimes different requirements because they are more focused on the numbers that will then be populated.
Quick question: do you want to put your slides on full screen?
Yes, I put it on a full screen.
It's okay. I can only see the window. I don't see them in full screen.
Stop
I believe on the bottom right there's a little symbol that you could use.
Okay, maybe I should start with a full screen. Okay, the full screen. Okay. Now please tell me if this is full screen.
We need someone to push the screen again. Yes, this is full screen. Thank you so much. Let's go ahead.
Okay, that's great. So this presentation shows my position, perspective as a biostatistician. Then what will be said is not to blame or unfairly criticize anything. I perfectly know what it means to use open source, and I owe R personally a lot, being in love with R since 2000. So whatever you will see here, please don't take it, much seriously, because, well, sometimes the truth has to be told to diagnose the problems and counteract effectively. So first of all, let me introduce the company. I work in a 2KMM. It's a local small company, CRO, Polish CRO with a global reach. We are 100% R-based, so it means we don't use SAS, we don't use other programs. Okay, maybe some Excel. We use R in very broad scope of activities, from trial design, investigations in data management, data investigations, creating datasets, analyses, research, creating TFLs, documents, and so on and so on. And so far, we have 28 projects completed. It covers both randomized trials and observational studies, mostly observational ones, and lots of ad hoc research. And this is all done with R. Our specific. We don't use CDISC yet. We are planning to do. Mostly our data sources are based on SQL views. We do lots of planned and ad hoc exploratory analyses. Sometimes we are asked to use some dinosaur tools, let's say. Sometimes the freshest methods that are available, and we need to do this with R. Being a CRO, we are not as powerful as big companies, so we need to accommodate to what we are asked from the sponsors. Our proposals may be questioned, sometimes without even without a discussion. When we started, we had to answer a few questions. Can we rely on R entirely? Will it suffice since everyone around uses SAS? Are there any hidden costs? Can we trust R? And what packages do we need to start? How to organize everything? And when we started in 2018, we were very optimistic. After 5 years, we have some conclusions or opinions. So R suffices to us, to our work mostly. Could we just sit and do our work with R? Partially. Unfortunately, we couldn't trust R numerically from numerical perspective, and we failed a few times painfully just trusting packages that we believed that were fully, so many people use them, so they should be safe. They didn't. We ended up with more than 200 packages, and we use them on a regular basis at work. We are happy with R. However, this is a tough love. But yes, we will stay with. And why? Because this is flexible and because it gives us a lot, and we learned how to live with R. First of all, cost. About cost. This is not true that using free software is costless. it costs the time that one needs to spend on doing side additional, activities that usually are done by commercial companies. So we had to validate the software, collect the library of necessary tools, contacting authors when something went wrong, and yeah, we had to pay for external consultancy for books, articles to fix things, and so on. So no, using open source doesn't mean, or free software, that this is cost-free. It's equivalent of about, let's say, 1 or 2 licenses of a good commercial software, yearly licenses, but this is a, let's say, one-off cost, single cost distributed over time, because what's done will serve for us, I hope. So we have better control over everything. Now we currently, after 5 years, we have a stable environment, well settled. So we can sit and work, but it was impossible when we started. In small companies, sometimes people say, come on, you have all the sources, you can do with R what you want, you can fix the issues, the problems. There is no issue. There is an issue, because in small company, even 30% of the staff that will be involved in this is much less than a big company can afford, and this is incomparable. So for small companies like ours, this is important. First, we had to organize our technical infrastructure. So there are a lot of details on the slides. They will be shared with you after all, so you can look at it with greater details, and we can meet and discuss if you are interested. So we organize the environment based on so-called portable R. This is R that doesn't need an installation, so multiple versions of R can be located on a hard drive in parallel without any interference. We use it extensively. The second step was to create a simple automated workflow. What it means automated? So it starts from Word-based templates in a Word document where the analyses are described, and then it turns into the final report where the placeholder for the contents are replaced with the actual tables, figures, listings. So we employ the R Markdown, and we obtain automatically log from all the operations, HTML log. We obtain Microsoft Word report with all the tables. So this is really very, very flexible, and it allows us to automatize a lot of things. Okay, well, this is the example of the log. So we have both the code and the simplified result, quite similar to SAS. Okay, then we had to define task, what we are going to do with R. So the scope of the analysis is very extensive. And for each area of interest, we had to find a list of packages that will work for us, that we, over time, it grew for about 230 packages, and we use them on regular manner, on regular basis. So this is not that we use it just once, and that's all. We have our Hall of Fame, which allowed us to join the pharmaceutical industry only exclusively with R, with a lot of additional tools that are just awesome and allowed us a lot. Now has issues. There are many sources of packages, and the versions differ between the sources. There are different ways of contacting the authors if anything goes wrong. So these are emails, these are just GitHub issues that I open. The second issue is the numerical validation of R, and I encourage you to visit another presentation presented at the Pharma in 2020 about the numerical validation of R. And in this presentation, I showed all the possible places where the R may give us discrepant results, not only versus SAS or other software, but also itself internally. So this is a serious issue, and usually, whether we like it or not, this industry is SaaS-centric. So naturally, many people will reproduce our analysis or try to recreate this. Journal reviewers, regulatory agency, our colleagues at the sponsor side, validators. So there is no place for argument whether SaaS is right or not. If people will determine any discrepancy, they will ask for the source of it. So if we do the numerical validation and we know what's going on, we can say, okay, it's just because SAS took different assumptions than R, but both are right. Just a bit different approach, but we know about that. To respond, we need to know what happened. So we don't care much about the marketing of packages. So, if it has vignettes, active community, 5 stars ranks, and so on, we care if it gives us valid answers. There are lots of key packages in this industry that are just essential and have no vignettes, no community, even no GitHub account, and they are essential. Okay, regarding the numerical validation, I just put some screenshots to show how serious is this.
Adrian, we are running out of time, unfortunately.
Yes, I'm going to the end. So we had to took our internal validation for each package and each function that we use, based on using reference software, reference datasets. Then additional problem is the multiplicity of packages and functions that we need to use and choose from. The lack of good manual, SAS and CSS, SPSS, and other software have very good manuals, documentation. With R, it is very unequal. Then things, what is simple in SAS, in R sometimes is very difficult, and we had to address it somehow. Also, the packages are often removed from CRAN, and we can do nothing with that for majority of reasons. And this is how usually the way of analysis looks like. So it's just stops querying authors, calling authors, reading manuals, searching, and so on and so on. But usually we are able to complete the analysis successfully, only with a very carved way. Okay, our plans. We want to try some new packages that are announced also at this conference, like the MMRM, the new tool, tools for the CDISC like Admiral, Metacore, and focus more on CDISC because currently we don't use CDISC, as I said. And the overall impression is that employing open source has its costs. It's very measurable.
We really have to move on.
Yes, this is the last slide. So yeah, the summary is that we gave us more than we expected. We are happy with that, and we are going to continue. Okay, thank you.